and will be, as I mentioned, posted online. Panelists, if you could have your video on so that we can make virtual eye contact, that'd be great. And today our purpose is to hear back from all of you as task force members about your initial reactions to the reopening plan that was unveiled last week. So first, a couple of things before we get to your reports. To say I've gotten a lot of feedback is an understatement, to be sure. We have gotten a significant amount of feedback from parents, community members, teachers, and students this past week. It's been very positive in general, very thought-provoking and helpful questions by some of you, by members of the community, and all around people all over the place. I didn't realize until the union leader said so the next day that we were the first to have a plan out there in the state. So didn't exactly know that we were setting the tone for a lot of people, but clearly we have. And I want you folks to be proud of the work that you've done so far, because our plan has been downloaded over 1,200 times from as far away as Singapore. And there are superintendents all over New England calling my office every day asking for copies of our draft. So whatever work you folks have done thus far has been well received by a lot of people, is making people think about things in a good way. So I just want to thank you all for that. I want to thank all of those people who have given me feedback so far. There has been a lot, and all of it I have read, not all of it I've read.
Okay, sorry. I'm gonna put my earphones in a minute. It's just us.
Kim, I'm going to mute you if you don't mind. And I just thank everyone for that, for taking the time to give that feedback, because it's going to make our plan better. So I want to underscore that it is a draft, and that nothing in that draft from last week is decided or committed to yet. And we as a group are going to land that plane together. And that's why we're here today and for the next couple of weeks, is to make that happen. With that said, I wanted to share some information that we've gotten back from some of our constituents. So we asked our teachers and staff to give an initial reaction about whether they would, what they feel about coming back to school, whether they would want to come back to school in person or stay remote, or if they, the middle option was, I'd be willing to come in if needed, but would prefer to be remote. And so 3 simple options. It was not meant to be definitive. We did ask people to put their names next to it, although I will never be releasing that information. But in the aggregate, I can share the following. Not everybody is answered. Not everyone is expected to yet, but this was meant to give us an initial first read on where we stood. So let me share that. I think I have the wrong screen open here. So about 246 staff have answered thus far. 113 of them have said they're in person and completely comfortable. I will say there's been about 15 to 20 staff that have reached out to me and said that they didn't know how to answer this question because they're willing to come in person but don't feel completely comfortable. But they're also not in the middle category, which was in person if needed but prefer remote, of which about 104 people put themselves in that category. And then some that said remote only, I do not want to come on campus until conditions vastly improve. So about 246 responses, and you can see the numbers somewhat align with our community survey of parents about their initial feelings about things. So I share that only to say a couple of things. First, we are never going to pressure anybody to come on campus, all right? So I'm gonna get out in front and say that. People who aren't comfortable, we're gonna find a way to make this work. But I share that because I mentioned last week that a lot of our draft plan is an act of faith in making, having these numbers coalesce and work. And so if we feel anything about this initial data, it's that we seem to be in the right ballpark. I'm trying to be, I don't want to be any more definitive than that because things can change. So I wanted to share that data. Also, last week, I'd included in my presentation a survey link for parents in the community. I committed to sending that out to the community, but I since decided to drag my feet and not do that. I wanted to hear back from this task force before I eventually sent out a survey to the community. So you folks really didn't have a chance to give me a lot of feedback. And before I went and asked the community what they felt about what really will be our draft or our final plan, I wanted to make sure that I wasn't completely way off before I did that. So after today's meeting and after hearing your feedback, tomorrow I will publish that information and a survey specifically. All of the information that we have thus far, including last week's recording, the plan document itself, and the PowerPoint are all posted on our website for anyone to review and to get up to speed with. So with that, those are my introductory comments. I'm going to ask for our various subcommittees to first weigh in and then open it up for commentary from anybody else. The first group is our medical and science community subgroup, kicked off by Jim Manning. Jim.
Thanks, Adam. So I'd like to start by saying that I'm going to turn the call over to two of our subcommittee members. But before I do, I just wanted to thank everyone that has been volunteering in our subcommittee. Yeah, these folks have really busy jobs, and they're all mostly healthcare professionals, school nurses, nurse practitioners, doctors. So they all have a real critical role to play right now with what's going on, and they've dedicated a lot of time to this. So I want to thank all of them, particularly the school nurses. They've been amazing. So the two folks that'll be representing are one school nurse, which is Deanna Courts. She's got her master's in public health, so she's well suited to deliver this information. And we'll also have Dr. Doug Allen, who's the chief of anesthesiology up at CMC, will support her in that. So I'll turn it over to Deanna, and she can start the presentation on the guidance document we put together.
Okay, thanks, Jim. Adam, can you make it so can I share screen here? Okay. Let me put it, okay. Come on, there we go. Oh, wait a minute, this is not what I wanted, sorry about that. Okay, can you see this?
Not yet, Deanna.
Well, share screen.
I can share it from my end if you want. I have the.
Nope, got it.
Got it. Okay.
Sorry about that.
I can see it now.
Okay. All right. So just pass this. The first slide was just an introduction. So to formulate our framework, we decided to go from 4 areas: mitigation, monitoring, response, and then the nurse management. For mitigation, we went on the colors that Adam had brought in his draft. And there was some discussion, I don't know if it's going to come from anywhere else, that maybe it might be better to have 3 colors instead of 5 for more clarity, but that's something you can bring up later. But anyway, for the green, yellow, and orange, if there's any chance of this being in school, we recommended masks for all staff and students with mask breaks throughout the day. We are strongly recommending that as many people that can wear them and on school buses if possible. They're a safe and easy way to help decrease the chance of spread within our community. Social distancing is another really important part as well. 6 feet apart is the preferred, 3 feet with facial covering for students and staff for compliance. PPE that's needed for staff or personal protection equipment. For nurses, we would need masks, gloves, gowns, an N95 mask, which is a specialized mask, 1 for each nurse in case we do have a COVID positive person that we're working with, and a face shield. For our special education staff and one-on-one paras, we're recommending masks, gloves, and a face shield, as many of those students that they're working with have quite a few bodily fluids that they're dealing with, so we want to make sure that they are safe. And for speech language pathology, occupational therapy, and physical therapy, they also work closely with students, and the same would be required for them, gloves and face shield. One thing we're looking into right now is masks that they're called smile masks. They have an opening around the mouth so you can see the person's mouth that's wearing them, and that's helpful for hard of hearing people. Speech language pathology the students need to be able to see their lips to work with them, so that's another thing we're researching as well. For self-monitoring at home is what we're recommending is staff and students do this because the logistics to do it at school, it would just be very trying. It would be hard to keep social distance, making a line of people waiting to be assessed. So we're recommending temperature checks at home. 100.4 should stay home. Questions that would be appropriate to be asked of each person before coming to school, that includes staff and students, would be any contact with a COVID-19 positive individual, headache, nausea, vomiting, diarrhea, cough, sore throat, shortness of breath, congestion, runny nose, chills, excessive fatigue, muscle or body aches, new loss of taste or smell, and travel outside of New Hampshire, Vermont, or Maine. That is actually just changed today in the state meeting. They're now recommending travel outside of New England is going to require quarantining for 2 weeks upon return to New England. And that's via public transportation or private. That just was in the meeting today that I was at. Any questions so far? Just keep going.
I do have questions, but it might make sense for you to go through your whole presentation and circle back.
Additional limitations. If there's not a significant need to be in the building, we recommend that you would stay home. Volunteers and visitors, we recommend minimal access to the building. And if they are necessary to come in, then we would require the screening questions to be asked and a temperature check, and they would also be required to wear masks. If there is to be an early dismissal or a late arrival of students, they would be escorted to the entrance from the entrance by a staff member, rather than have the parent enter the building. We're recommending that parents call the school from their vehicle to announce their arrival and wait out at the main entrance. And one reason for this is the frequent touching of the doorbell to ring in to the school as well. Staff meetings we're recommending to be via Zoom. All other meetings to be via Zoom as well, such as special education meetings or parent conferences. We want hand sanitizer in each entrance to rooms, and so you recommend to sanitize in and sanitize out. No staff room accessibility, because that would be congregating of multiple people. Frequent cleaning of high-touch surfaces and bathrooms, and we're also strongly encouraging teachers and students to participate in this as well, and that would be taking a caring attitude of the environment that they're working in. But also, of course, I mean, the custodial staff would be the main cleaners. And then from a parent recommendation, is that if you're a parent of multiples, we are saying that it would be nice to have the multiples in the same class. Education is a huge component of our plan. Educating staff, the community, students, hand washing and hand sanitizer, the proper use of it and when to use it. Staff should be required to view this before starting school, and students will be shown it on the first day of school. But we also would like to make it available to parents to preview with their students at home before they do come to school. We also believe that there should be some kind of education on the proper use of PPE and how to put a mask on and take one off. We suggest that parents start teaching their children about the use of masks and have children practice masks use before the first day of school. I think if we have high expectations for children, they generally meet those expectations with practice. So that was where we came up with that. And children can wear masks. They do pass on COVID. Children that are in hospitals for severe illnesses wear masks. So it is doable. It can be a challenge, but it is doable. Educate parents on the signs and symptoms that will cause their children to need to be dismissed, so that they're not surprised if we do call them. Cleaning of surfaces, educate how that should be done and when it should be done and what surfaces should be done. And then communicate with staff, educators, and families and what to look for with their students in their class, including symptoms of the multi-system inflammatory syndrome, which is something that some children are having down the road after an exposure. So we would need to teach people about what to look for. And staff should feel free to report any personal symptoms or close contact to a COVID person to a supervisor, administrator, or school nurse. For monitoring, that's where we had said monitoring at home rather than at school. There's not a lot of data on which would be better, to be honest with you. At school, we just want to avoid having any congregating of a lot of people for monitoring. And that could change depending on what comes up with state data and county and municipal information. The response part of our plan, school nurses will know how to respond to symptoms of a possible infection, who to contact, how to contact those people, and have a place and plan of where we can isolate these children waiting pickup, because they really can't be around other children or staff. And then the New Hampshire Department of Health and Human Services would provide guidance on us if we do end up finding out that there's a COVID positive person in the school. They will let us know what to do, as they do for any communicable disease right now. Specifically, nurse management. I mentioned earlier, we need to have another location for a person that presents with symptoms to wait for dismissal. Students that are dismissed will be escorted to car by a staff member rather than have the parent come to the building. Doesn't necessarily have to be to the car, but at least out the front door to the parent. All the nurses' office in the district need to be scrutinized to be assessed for readiness, including feasibility of social distancing. I don't know if you've been in nurses' offices. They are not adequate for this type of spacing. And particularly Mount Vernon is like a little closet. Two patients in there would be really hard to get 6 feet apart. So that needs to be worked on by the district to find another spot for her. And the nurses' resources will need to be reviewed if we have escalating demand for the services. And also that includes subs. Let's say one of the nurses ended up having to quarantine because of exposure. We need to make sure that there's a sub available, because right now our sub pool is very small, and we might need to contract with an agency to have that availability. Other questions that we came up with is that we want to assure that there's a readily accessible quantity of PPE that we can get access to. Is that from the state, is there a possibility? What I've checked into is the state wants us to use them as a last resort. We've got to go through private vendors, so that should be ordered sooner than later, so we have that at the start of school. Information, we want to assure people information about positive cases will be held in confidentiality by the school nurse. And self-quarantining, like I mentioned earlier, for 14 days is now what's recommended after travel outside of, I'm sorry, that says New Hampshire, it should say New England. And that's as of the 14th. And again, all these may change depending on the progression of this whole COVID episode stuff. Oops. Is there any other questions?
Yeah, I'll open it up to the group in a minute, but I thought I would ask a couple of questions first, just for clarity's sake. So I reviewed your document earlier, and back to the mitigation, which I think is your third slide. So your subcommittee is recommending masks for all students and staff during green, yellow, and orange. The draft plan last week requires them in orange and yellow and recommends them in green. And nothing in the draft last week recommended anything for students younger than 5th grade. So I want to be clear that you guys are recommending something different than what was in the draft last week.
That's what we are recommending.
Okay.
And that's based on science from CDC, Department of Health and Human Services, and any other sources that we've gone through. All of us, that's what we found. I mean, Doug Allen can hone in on that if he wants to. But it was agreement of the whole committee.
I just wanted to clarify the difference between what was presented last week and this week. That's helpful. And then walk me through below where it says social distancing, required 6 feet apart, preferred 3 feet with facial covering compliance. So Deanna, walk me into a classroom where there are, I'm going to make up numbers here for the purpose of clarity. There are 7 people in the room, all of which are more than 6 feet apart from one another. Are they wearing masks?
I would say yes, because they're not 6 feet apart all the time. Kids are moving around the classroom, teachers are moving around the classroom. And honestly, to put your mask on and off and on and off, you're touching your face more often. You're exposing yourself to the outside of touching the mask. So it just makes sense to keep them on. If you have to run an errand down the hall or, you know, go to the bathroom, you're putting the mask on and off constantly all day long. So the better idea is to keep a mask on.
Okay.
And then make sure that there's mask breaks in there too, because everyone needs to have a break from a mask, because it can be, you know, claustrophobic wearing them, but you can do it. It just takes getting used to a mask.
Okay. And then I've got some other questions not related to your presentation. So in some places, in other parts of the world, actually, and I've not heard of much of it in the United States, but buildings are being outfitted with automatic temperature scanners that scan people when they enter a building. Has your group evaluated the efficacy of those sort of devices in our schools? And do you have a recommendation about it?
Yes, we did have a discussion about that as well. A few people in our group work at a hospital and they've used those kind of things. They're not the most accurate. It depends on the temperature outside. If you came in from an outside where it's hot and you're sweaty, you walk through it, your temperature could be high, and you sit for a minute, your temperature could be lowered to normal. So the accuracy for the cost of those, we didn't feel would be appropriate for schools.
Okay. And then what of, my last question before I turn it over to the panel, what of any sort of required recommended testing for COVID-19 of students or staff? Is there any value to any sort of something all the way from a mandate down to a recommendation in any circumstances?
Funny you bring that up, because I was going to mention that as an after for the presentation. Testing gives a false sense of reassurance. When you have a COVID test done, that will tell you whether you have COVID at that very time that the test was done. You could be incubating, so maybe the next day you could come positive, and you wouldn't know that unless you started to have symptoms. So if you're asymptomatic, unless you test, you wouldn't know it. It's just not, it creates a false sense of security. It's expensive, and tests are not as easy to get as people might think they are to get done. We were told by one of the members on our panel that the tests go for about $250, some of them. And the ones you can get the same day are not very accurate. How many days do we have to wait for the results? Who's going to do the testing? The cost, who's going to pay for the testing? And like we said, it's just not an accurate way to tell the status of what's going on in the building.
Okay. And I wasn't honest. I do have one more question. So back to the mask, your recommendation for masks to be worn in orange, yellow, and green. I think I would ask that I see green maybe perhaps differently than maybe your subcommittee does. We might need to talk through what it means to be in the green status, right? Because for me, green is where things have improved greatly, and we're approaching that near normal state, in which case a recommendation for masks might be, I would think, appropriate. But so I think what I'm saying is we probably need to do some more work to define what the different statuses mean based on community conditions, because that probably is where I don't think we probably actually disagree. I think there's probably discrepancy between how we define the different statuses. That's my,
Adam?
I guess that's more of a.
Adam, it's Jim. Yeah, I think that, and Doug, if you want to jump in here too, that would be, you certainly feel free to do that. I think the thought process was that given the current condition, situation in the United States, as long as there are going to be people in the building, right, that we want the guidance within our document to be followed, whether it's green, yellow, or orange. And as far as the mask situation, when we say all, I think where the collective of the subcommittee, and I don't want to misspeak here, but the collective of the subcommittee had decided that we need to be getting as many people, be they staff, teachers, or students within the school system, to be wearing masks, regardless of whether they're teachers, their staff, what their age is. Ultimately, that's where we landed, simply because we know that that strategy will reduce community spread. And I think the last thing we want to do is have the school shut down in the middle of the fall. That's where the thought process was. And I don't know, Doug, if you have anything you wanted to add to that.
Yeah, I guess with regards to your green versus blue, what we acknowledged was that at some arbitrary point, when you're navigating approaching herd immunity, be it through vaccine or natural causes, you might find a path to easing up, but generally speaking, it's a little more definitive of a distinction. Either you have a risk or you don't, and you either need to have measures in place to mitigate that or you don't. But to have a transition point where they're optional just creates an exposure that is either justified or it's not. And to the testing, I think that our general consensus is that testing will be reserved to help navigate circumstances, being guided by the state or otherwise, where you're trying to either return from a red point or navigate a presumed outbreak of some kind, to see the scope of it, considering that it's likely to have many asymptomatic people. But in the absence of that, random testing is not likely to provide you with much feedback, because you're just going to be confirming what you know is in the community, where you're getting the data from elsewhere.
Okay.
One other thing, Adam, with the masks as well, is some areas of the United States, you know, they thought they were doing pretty good and eased up on their mask requirement, and then got a surge of illness again. And that's one thing we really want to prevent doing. And it's easier to stay with it. Makes more sense to stay with it than to say, oh, hey, we're doing pretty good. Well, we're doing pretty good because we're following guidelines. So that was our view as well.
Okay.
If I might, I can revert back to your other question before about how much spacing would allow you to have a mask-free environment. I think, as you've already acknowledged, your HVAC system, under the best of circumstances, is going to be a bit of a liability. And I think, you know, unless you have select circumstances where there are very few people in a room, the general principle is going to be masked when you're in the vicinity of other people. Specific, 6 feet, 10 feet is going to be hard for asking people to operationalize. If there's someone else in the room with you, put a mask on.
Okay, that's helpful. So, and speaking of operationalizing that, is there any data, any study yet about any age-specific vector-related data? I guess where I'm going with this is masks work. I support the use of masks. Don't hear me wrong. I'm struggling to understand elementary kids wearing a mask during the school day. I'm just there's dissonance for me between the recommendation and the reality. So help me, any of you, with that. Is there any data that supports?
I'll start and then I'll kick it over to Doug and then others. But so maybe I was where you are, maybe even 48 hours ago, Adam. I have colleagues and work in Europe, and there's interesting data coming out of Italy and Germany about transmission between children and all of that. The reality is that we're just too early on in this to have any kind of conclusive peer-reviewed data around that, from at least as far as I know. And so one of the things we have done is consulted a few people who work in the early childhood education space, and I've talked to those folks this week. And one of the things they've said to me, and these are people who have 30 years experience working with very, very young children, not in the school system. We're talking about preschool age children, kids in Head Start, those types of things. And what they said to me this week, which was convincing, was that if adults model the behavior, it's surprising how well kids model the behavior. The challenge is going to be if, and hopefully people will take this the right way when I say this, but if children go home and people at home are challenging that behavior, making it negative, saying it's something that we shouldn't do, it's going to be very difficult for the children to obviously model that behavior in the school system. So the reason I point that out is because if you choose to do this, and ultimately it's going to be your, it's up to the leadership team at the SAU, it's going to be important for the entire community to buy in, because that modeling is going to be extremely important as you get down into the younger grades. I think we can all agree that 5th grade and above, we could probably manage it. The concern is really pre-K through 4, and that will have to be an essential element in my view. I'm just speaking for myself based on the conversations I've had this week. Doug or Deanna, do you guys have anything you want to add or contradict there?
No, I agree with you, Jim. Children, it might be less often that they get COVID, but according to Dr. Talbot from the state of New Hampshire in her state call today, she said children get COVID. They sometimes don't get as sick, but they can still pass it on as well. We are looking at the health and welfare, not only of our students in our school, but also of our staff and our community. So it's a whole picture, not just, take care of the students, but we've got to take care of everybody, because if we don't have the community and the staff there, we don't have the school.
Yeah, I guess we navigated this for a little bit last night in our call, and there's no reason to come to a conclusion that the pathophysiology of this virus is anything different than the rest. Children are navigating this more asymptomatically, but they're still spreading it. And so it's the most definitive measure that you can use to mitigate the spread in an environment where you have people in close contact. It's not lost on any of us that the success with masks in this environment is not going to be the same as it is in the other age groups, but that doesn't absolve us from setting as an expectation and working as hard as we can to get their buy-in. And I think they'll surprise us. There's a lot of examples out there of other cultures that have set a lot of precedents for this. So I think we set the expectation and recognize that it's not going to be perfect, but any compliance you get, even if the kid's only wearing the mask half the time, that's better than nothing.
Okay, that's really helpful. I want to share from my perspective that that there is a giant leap between a recommendation and a mandate in a school, both legally and through public perception. And so if compliance is the hope at the elementary level, it's a significantly different fall and winter for me if it's a mandate than whether it's a recommendation that we attempt to model for our students and encourage. So that I just wanted to say that. But I've been talking a lot, and I promised to open this up to the group. So Shannon Gascoigne and then Georgia Craven. And then Dan.
Thanks. Just a couple questions for Deanna. I'm curious if you all discussed how lunches and outdoor classes would work. So I know there's talk in the plan of trying to get the classes of students outside. When they're outside, would the mask situation change at all? I'm curious of that, and I'm curious about the lunchroom situation, because those are very crowded spaces.
We didn't bring those up in our committee because we felt that was probably another space committee. But if people are outside and you're 6 feet apart, then masks are not necessarily recommended by the CDC. So that would take care of that. So.
Thank you.
I think we did discuss it to some degree, but assumed that it was a little bit of micromanagement. I think that, as Deanna said, outside allows you the spacing and air circulation to create mask breaks, as long as the kids cooperate with that. And the lunchroom is going to fall into the category of a concerted effort to minimize multi-use spaces and traffic throughout the building. So the general principle is to avoid those. So the presumption is that there would be an effort in trying to have the kids eat lunch in the classroom, or solutions that I'm not prepared to speak to, but the general principles are that if you're going to have multi-use spaces, it's going to require a very high level of sanitizing between use.
All right, Georgia, and then Dan Black.
So I just had a couple of kind of points. And one of them was I had been talking to a couple of families with younger kids in the schools who are really hoping for some masks to be required. And one of the big points that kind of helps me understand it is that when I was younger, I was told you have to wear pants to school. That's something you need to do. And so I don't see why we can't just say you have to wear a mask to school. You have to wear pants. It's the same kind of thing. You're just putting it on your face, not your legs. So that, little things like that, it doesn't have to be as hard as people are making it. And just say oh, this is just something you have to do. And 75% of the kids will just do it easily. And the kids that I nanny have been wearing masks everywhere they go and they don't complain about it. So it's just something that we should at least try. And then also you guys had mentioned something about temperature checks, and I was thinking maybe we could make a Google form that we send out to families, and before you send your kid to school, you take their temperature and put it in. And then we have a log of everybody's temperatures. And then we don't have to worry about doing the temperature guns that don't work. Everyone gets the same temperature. And then it's just a lot easier for everybody involved, and we'll still have that log. So I don't know if you guys had talked about doing something like that, but I felt it could be an efficient way to go about that. But also I had heard a lot of concerns about not having enough PPE inside the school for if kids forget it or not, but you guys addressed that. So I just wanted to say it was a really good presentation. You guys thought about a ton of stuff that I hadn't even thought about. So thank you guys for doing that.
Thank you.
Thanks. I just want to make a quick point and then ask a question of the group. I think the work you did is great. It's spot on. I've become far too familiar with the science behind it over the last couple of weeks, and I think it makes a lot of sense. I just want to share in Londonderry that we first rolled out, we're going to require masks in grades 1 through 12. Upon hearing that, our pre-K and kindergarten teachers want to do the same thing. I think we worried about how well it would work with the younger kids, and they want to push for it. And actually right now in our summer school program, where kids are actually in person in buildings and they have IEPs for preschool, they are actually wearing masks. It only took them a week and a half to figure it out. So to Jim's point, it's possible. It's all about the culture you said. So I think one way to really think about this is, can we set a really positive, happy culture for kids? It'll be different. It certainly will be hard. I think one of the things that I know parents and everyone are grappling with is face mask breaks. Is there any scenario where a face mask break could happen within the classroom? I think outside is obviously ideal and safer, but if kids are 6 feet apart, and basically from what I'm reading from the science, it's the respiratory droplets when you sneeze, cough, and talk that spread the disease. So if kids are 6 feet apart and they're working quietly and there's no movement, could that be a time for face mask breaks, or is it just too risky?
I would think if you have your windows open, let the fresh air in, that may help some, but like you said, it's going to be better being outside than it would be inside, but you'd have to have the strict social distancing as well.
I think it's a great idea to tease out as you navigate this in real time. It's going to be a slippery slope, I fear, because you give them an inch, they're going to take a mile. But I think if you have an adequately spaced out room, you might be able to pull it off. But I think the more you sell masks are necessary when you're in the classroom, and then have hourly breaks where you are out of the classroom, that's probably your best chance at meeting your primary goal.
Dr. LaBranch, and then Peter King.
Adam and the rest of the committee, one of the another way to possibly mitigate this, and I know from one of my former school districts, they made a considerable investment with respect to shields, particularly at the elementary level, and having the plexi shields. So in terms of looking at mitigation with respect to mask and mask breaks, and at the elementary level, if we had the money within the CARES Act to, if you will, invest in some of these desk shields, both for the students as well as the teachers, that might add, if you will, to the problem solving here with respect to how do we give these students breaks.
Agreed on my end. I don't know the science behind the plexiglass sheet.
Yeah, but I don't know the science either, but it just seems to me that the more mitigation that we can create, the more comfortable people are going to feel with respect to the environment and the safety of the environment.
Dr. LaBranch, I don't know that our subcommittee discussed that specifically. I don't think we've gotten to the point where we've gone to solution with regard to what the social distancing will look like in the classroom, other than to say that we need it. It's probably a good topic for the next subcommittee meeting. I know some of the Asian countries have done exactly what you're talking about. They've created pods, for lack of a better word, pods for their children within the classroom space. So it's something that we can certainly discuss during the next subcommittee meeting.
Thank you.
Peter King and then Nate Jensen.
Okay, thanks. I think this group has done just a fantastic job. I'm really impressed with everything you've done. One quick comment, what Georgia mentioned about Google Docs type of forum or something online. I don't think that's a bad idea. I was on a call with a bunch of industry a few weeks ago, and people were talking about ways to get their employees logged in that they have gone through the checklist. And there are commercial programs out there that do it, although I think they're expensive. There's also people who are doing it in-house with their own software. The other benefit of that is it's HIPAA compliant because the information's not written down on pieces of paper or logged or anything like that, but it can be confidentially logged. So that's something, if people want to look into it, they can. It's beyond my capabilities. But I did have a question though for Dina, and it had to do with confidentiality. And I think if a child or even a teacher becomes sick, it should be confidential. But on the other hand, how do we let the community or parents know that there's case or cases in a classroom? Thank you.
I would take directives from the Department of Health and Human Services because it would be reported from them. My concern with, you have to be confidential about it because if we give out the name, first of all, it violates all of our, health laws, but we're afraid of a lynching type thing almost, you know what I mean, with the community. So contact tracing would be followed by what the Department of Health and Human Services recommends. And that's one thing we didn't know if the district needed someone that would be specifically assigned to help with that or whose job that would be. But the state of New Hampshire does do contact tracing through the health department if someone is deemed positive. Does that answer your question, Peter? Or?
Somewhat, and I'll just give the example from an employer standpoint. If somebody in the building that I'm sharing with other tenants gets sick, we're supposed to be notified by the landlord that there's a tenant that has tested positive. So I don't know how that would work in a school.
Well, we could notify that there's someone that has tested positive in the school if that's what the state recommends to do.
Okay, yeah.
Especially if it's in the class that you're in.
Right.
If there's not
I think you might want to take a step back and think about how this is actually going to play out. If you familiarize yourself with the symptom log for what's going to qualify you to reflect on whether or not you're positive. It's pretty robust. And there's going to be kids out of school, if they're following our stringent expectations that they don't come in when they could potentially be symptomatic, there's going to be a lot of kids out of school that are navigating non-COVID illnesses that are declaring whether or not they are or not based on either testing the symptom profile or waiting out the 10 days to come back. Our obligation, we won't know whether or not they're COVID positive. That will be information privy only to them, their doctor, and what gets reported to the state. We'll only know that 3 out of the 20 kids in the class weren't there that day because of illness. And we'll rely upon the state to give us feedback if there's sufficient numbers in our school to act upon it, either through contact tracing or a specific investigation of the site or nothing. Does that
I
help?
don't have any way of diagnosing, Peter. It would just be what we get information from the family, from the doctor, from the state, as Doug said. Nurses don't diagnose this. We would just come up with symptoms that need to be, identify symptoms that need to be evaluated by the primary care provider.
No, this helps a lot. So it's basically, this has to come from the state and it can't be part of our plan, basically. We can't make it up. We can't make up our own rules as to how we're going to disseminate this information. That's
No, luckily we're unburdened from having to do so.
right.
It's not our information to know.
Good.
However, I would say that I think a community expectation that will be put on us will be to publish things like attendance rate in schools, meaning of the X number of kids enrolled in the school that are planning to attend in person, how many are showing up on a given day. I think that is information that would be expected that we provide to our community so that that parents can be informed about what's going on. We'll have to think more about that as we go forward, but information in the aggregate can be helpful. We began doing that this past year anyway, when we had a flu spike in January, February. We didn't publish it, but we started tracking it because we were prepared for our public to start asking for it when COVID was just a far off issue for us. Before I get to Nate, Jim Manning's doing a great demonstration of what social distancing in a first grade classroom should not look like. And George's pants comment is the highest trending topic on Twitter and Amherst right now. So thank you for that, Georgia. Nate Jensen.
Thank you. I'm sorry, I've got some noise in the background here. So I just want to offer one criticism of the presentation. I think that most of what you've done is good, but I do disagree with the mask recommendation that you're making on a philosophical ground, not on a scientific one, which is that I think the thing that struck me most positively about the draft plan as it was presented last week is that we are asking parents to make their own calculation of risk for themselves, their children, and their families. And I understand the urge to try and mitigate all of the risk that we can having children come into the schools. But I think the reality is that we can only mitigate so much of the risk. And so I worry that having a mask recommendation and a requirement or a mandate, depending on what the decision is, may be a miscalculation for people, or there's a possibility that they may misinterpret the risks that they are facing by sending their children into the school. And for those that are not willing to take the risks, I think it's appropriate for them not to send their children to school. And if we are saying to them, well, with our masks in place, therefore we've mitigated all the risk possible, there may be a false sense of security that they develop. So on a philosophical ground, I think that it's a mistake to suggest that we are mitigating all of the risk, which is what is implied in the requirement for having masks. So with that, I'll sign off.
Appreciate that, Nate. That's a helpful perspective, because I can tell you already that's a strong sentiment in our community as well, that if we're giving choice to people, they can make an informed decision for them, not forcing anybody to come to school. That's all part of the puzzle here. And just to clarify, my goal is that this task force refines the plan and that we have a plan that we feel general consensus about, saying this is the plan for SAU 39. So I'm hoping that we can move through these discussions in a way that we disagree on points and then come to consensus on how to implement and move forward. So who was next? Was anybody else to respond to the medical presentation? Okay, excellent. Deanna, Doug, Jim, others, thank you for that. One common refrain in our community is that people are learning as much from our meetings because of all of you than they are from any other source. And it's very appreciated. These conversations are helpful. Not going to help me sleep at night, but they're helpful. I'd like to move along to our teacher association and faculty and staff group, which is Stephen O'Keefe and Amy Facey. I know Amy's on vacation, but Stephen, you folks have a report for us, I believe.
Great. Thank you, Adam. And I want to echo exactly what Jim had said, where you've got a team of, close to 40 outstanding professionals that work for our community day in and day out throughout the school year, and they're volunteering their time during the summer to make this a better experience for everyone around. And kudos to them, and more specifically to Sue Sprinkle, who is doing a lot of the logging of our conversation, which can get pretty deep and pretty quick throughout our meetings. So thank you to her as well. Four of us are going to actually quickly share some thoughts in terms of the overall presentation and the deck from last week. I'm going to share two, and then I'm going to turn it over to Jolene Sawyer, and then, I'm sorry, to Steve Dreyer, and then to Jolene, and then to Katie Kennedy to wrap it up. First and foremost, in terms of the actual deck, there were two recommendations that I've got in terms of consideration. Number one is the segmentation throughout the year. The periods, whether it be 10 segments throughout the year, is at the beginning of the calendar year, that we try to think about making those a little bit lighter, having a shorter period of time in there, because that's going to allow parents to gain more comfort in what's going on, allowing faculty and staff to work with their peers, talk about best practices, what's working, what's not working, and allowing that natural sort of break to kick in and maybe go a little bit longer in the November, December timeframe, if of course the conditions warrant. But the segmentation is to rethink about how those days are allocated, specifically the month of September and the beginning of October. So that's some feedback. And then the second piece of feedback, it's not actually in the overall draft plan, but I think it's something that needs to be added. And it's more specifically surrounding building administration, because at some point we're talking conceptual here, and the draft plan is designed to incorporate all of our buildings as one, an entire district. But at some point we need to get down to the granular level. So a teacher at the Mount Vernon Village School understands what her day is going to be like, and can start to make those preparations between now and then. And something that I heard pretty resoundingly is that faculty want to participate their administration in those conversations. And so as a superintendent, maybe we can include that in the copy, is creating a timeline where building administration can start to begin to meet with their direct reports to help guide, or at least map out how each building is going to respond to these greater recommendations. And yes, it's draft at this point, but at some point it's going to be too late for those conversations to actually have a true impact in September. Jolene, I'm sorry, Steve Dreyer, I'm going to turn it over to you, sir.
Thanks. So Adam, you talked at some length about redundancy in your presentation last week, and there were a lot of questions that came up from the teachers regarding that. In an ideal situation, obviously that would work. Well, you have redundancy, but there are still questions about so teachers need to get their pacing pretty much exactly on. And then if one person has to step out due to illness, does that mean that the other person is now responsible for twice the number of students? Those kind of questions. So that's where redundancy does exist. There were other questions about, there are lots of situations where there's sort of only one person: music teachers, specialists, interventionists, support staff, special education staff, AP teachers at the high school level. So there's a whole lot of question about what is the implication for those classes. You specifically mentioned Sue Downer with AP Chem, and I'm pretty sure she's the only one who's actually, qualified or certified to teach that class. So those questions came up. Then, of course, the whole planning thing, which is to say that if you are going to have that kind of redundancy, people need to really work together to figure out exactly how they're going to unroll their curriculum against the backdrop of those 10 sections, which is going to require us to rethink the pacing of the curriculum anyway. So that a lot of time is going to need to be dedicated to that. And then also paras in the special ed world, because as you know, paras work specifically with individual students. How do you have redundancy there? And if you're going to talk about long-term subs and such, what kind of training has to happen with that, and so on. So just the broadest sort of category of this is a lot of thinking and clarification is needed around that concept of redundancy. So, thank you. Jolene.
Hi. Thank you. I think I'm going to talk a little bit about the parent opt-in and opt-out dates and the teacher staff opt-in and opt-out dates. There's a little bit of overlap. I do think that there was an appreciation out there for the desire to meet everybody's needs. At the same time, I think that there is also that because there are so many unanswered questions about how that gets done, it's also creating a bit of anxiety around how that could possibly work. We took some notes regarding some things that would have to happen in order to make it work. And it will definitely be important for communication for guardians to commit clearly to, sometimes you don't get feedback from parents, to commit to which modality they want their child to be in for that section of time. And what happens if you don't get that information from parents. Also, one of the things that for those who are going remote, there was a lot of talk around needing to establish some sort of guidelines in order, some etiquette around what remote learning entails, what the expectations are for both parents and for students in terms of, to provide the optimal learning conditions for kids who do choose the remote modality. We had some questions that came up in the parent section. Again, a little bit of a repetition of what Stephen had mentioned, but wondering if the 4 weeks is a bit too long for the first section. And also a little bit about what are the goals for that? Is it purely about connection? Is it curriculum? You had a lot of focus on academic rigor in your plan, but we talked about maybe like using that time for social emotional connections for kids. So that was something that came up. We also are, a question that came up that I think is going to be, have to be addressed is about inequity. Like if I am home and I've only got 8 students, but somebody else is in the classroom and they perhaps have 24, is that an equitable experience for teachers? And how do we mitigate that and make sure that everyone has the same, the same experience, more or less, to the best that we can. In terms of, I'm kind of going into the teacher and staff opt-in, opt-out dates. But one of the things we felt that we're really gonna need to build a system. If we have 10 of those flex periods, we're really gonna need a system to support that, to build in time to collaborate. We're gonna have to really be thinking creatively about supporting new staff to our district as well. And also, who is the person who is gonna organize that? So that there's got to be a point person who, no, Adam. So there's got to be a point person in order to place the teachers and the students. How is that communicated? Do teachers have a voice in their roles? And it kind of overlaps a little bit also with what Steve Dreher was just saying about the redundancy piece, because if you're looking for redundant sections, we're gonna have to figure that piece out in terms of who's in the building, who's out of the building. So we just have a lot of questions. One of the wonders that came up is it possible to run a simulation to see how the logistics of this? Could we possibly test a big group of kids with a handful of teachers and see how does this play out if students pick staggered time A, B, opt in, opt out? What if they want to switch between the different modalities? And how do we lessen the disruption to classes for kids who are switching in and out with some frequency. I'm not really sure I don't think any of us are really sure what to expect in terms of how fluid those choices will be. Let me see. I think there was a feeling that, that the flexibility is both empowering and a little overwhelming, and that in order to manage this, the timeline needs to be moved forward. I think we have a lot of questions, and in order to get moving, for people to feel like they're comfortable doing whatever is asked of them, we really need to have some details so we can flesh this out and get to work, because there's a lot involved. But there was an appreciation for the flexibility in the plan. Katie?
Thanks, Jolene. Hey, Adam. So Deanna and her team actually made my life a little bit easier, because my topic that I was going to share out on was all about safety. So basically, the three big things that came up in our subgroup the other day about safety was the mask issue. Again, noticing that in the yellow zone, it's grades 5 to 12, masks, K to 4, not masks. Obviously, that leaves us a lot more vulnerable in K to 4. So that was something that definitely came up a lot in the conversation, like what's that going to look like for us? Social distancing, what is that going to look like in the classroom? Are we going to be guaranteed a smaller amount of children so that we are able to actually social distance them in the classroom? In the elementary grades, we have a lot of tables and not desks. So that has come up a ton with elementary teachers as a problem that we need to solve. And then the hand washing thing, which Deanna also touched upon. And I think, like, big picture wise, as teachers, I'm pretty sure I can speak for everyone saying we are willing to jump through any hoops in terms of scheduling and curriculum and things like that. But I feel like before we can get to any of that, like, the first priority has to be our safety as staff and the students. And I'm saying that as a mom, I'm saying that as a teacher, colleague. So I feel like anything else we can tackle. You know what I mean? Like, if we go in there feeling like we're safe, we're good. We'll figure everything else out. So I feel like that was just kind of like the general consensus from staff members. The other part that I was going to talk about was the staggered start. We just needed some clarifying information on that and more of like what that looks like. For example, what if the bulk of the staff want to do the 7:30 to 2:30 and not the 9 to 4? Or what if the bulk of students want to do 9 to 4? So, how do we decide? How do you decide who goes into what section? The other thing with the safety part, another thing that came up is, what is the rotation of kids versus the rotation of staff look like in the older grades? That's not as much for elementary, but we talked a lot about cohorts staying together, and what does that look like in middle school and high school? And also like specialists coming into classrooms versus going into their rooms, things like that.
Got it.
There's a lot of information, sorry.
It is. I've got a lot of responses, but I wanted to let you guys finish first. But I think, Katie, you should get shirts that say Maslow before Bloom. That's a lot of what you're saying, right? That's
The what?
safety
I'm
first.
sorry, I didn't speak that.
Maslow before Bloom, right?
Yeah, exactly. Yeah. Oh, the other thing I was going to mention too, Adam, is, people were talking about, like, can elementary kids be trained to do this? I cannot speak for kindergarten or first grade teachers because I've never been a classroom teacher for K1, even though I've worked in those grade levels. I feel very confident saying to you that I could have definitely taught my kids last year in second grade to use and wear masks appropriately. I agree with you, Deanna. I think if we raise that bar and we teach them explicitly, just like we would anything else, then I feel totally confident that they could accept that challenge.
100% confident you could, Katie. Back to Stephen O'Keefe, and then I've got a couple of questions or comments.
Yeah, so just one quick thing I wanted to reemphasize, and Jolene quickly touched on it very quickly, and that's the concept of flex days. Flex days have to be included in the overall plan for the fall. As we start on day one, so we set the expectations with the community and with the students and with our faculty, giving them an opportunity to do, coaching for peer-to-peer and talking about those best practices that are going to be so vital when we eventually have to switch over to a remote environment. Yes, we're sprinkling in some additional professional development time, but having that capacity during the week, so an 8th grade teacher at the Amherst Middle School can talk to someone else in their cohort who may be remote, just talking about not only that week, but what's working, what's not, so we can make those on the fly changes as time goes on, and then work with the building administration so we can identify pain points. If something's not working, administration can go ahead and identify those pain points, work with them on those flex days, and allow the kids the opportunity to acclimate back into the classroom in the fall. That's extremely vital. And the very last thing that, and I wanted to add this to the list because the medical team had talked about it, and specifically Deanna, if we're going to go ahead and institute a policy where folks that are traveling mid to late August for our last opportunity to get out, we need to inform them right away that they will not be welcome back to school in September if they are not meeting that 2-week quarantine period, because that's going to definitely change some parents' last minute strategy if they're going to upstate New York, if they're going down to the Jersey Shore, or wherever it may be. If we're going to be really tough about that, we have to make sure that we inform our community of that sooner than later.
And I think they need to know it's a state requirement. It's not something that, Adam, our school board, is saying. That's a state recommendation.
Okay, a couple of things. First, this is like a space mission, and this is not like a space mission. So bear with me for a second. So this is like a space mission in that none of us have done it before, and in large measure, we're not really sure how to get there, but we know that we've got to get there somehow together, right? So it is like a space mission in that my role, this committee's role, is to set where we're going, and it's our teacher, faculty, and staff who will figure out how the best way to get there. I feel committed to that model of figuring this out. This is not like a space mission in that it's not going to be perfect when we push launch. Okay, we need to accept that we're not going to abort and wait another week till a better weather window comes down the pike. We're going to start August 31st. We're going to be in good shape when we start. It's not going to be perfect. We're going to learn and iterate and get better, but realize that this is in many ways the new normal for us, that this is probably the first crack we get at this, but not the last one for sure. So with that said, I feel strongly that our planning process has to include our faculty and our staff. And so right now, July 16th, we're in this almost awkward state of, we've laid out a very aggressive plan that kicks off August 31st, but not a lot of it is defined. Well, that's on purpose because we want our faculties the opportunity to do that. There's a great parallel with how Souhegan started, and I go back to this example a lot. The community decided what type of school they wanted to have. They voted it into practice, approved it, spent the money on it, and built it. But it wasn't until the faculty showed up those 3 weeks before the first school year started that many of those things were more clearly defined, like the Souhegan 6 as an example, which I know was 7 at the time, but has since become the Souhegan 6. That's what we're looking at for this planning process. And so our principals, who are working day and night, much harder than I am, are working through these logistics to build a system that will work, but we are intentionally holding them back from going too far until they have the chance to work with our faculty to start the process of implementing this stuff together. So they don't know that I'm doing this, but I'm going to call on them quickly. Anna, could you just speak to the logistics planning process that's being put in place, that's already started actually? Could you just speak to that briefly?
Sure. The four principals have been meeting daily and regularly. And as we continue to get information from the task force and information as just the information coming from the survey, we are putting together plans based on the information, Katie, like based on the safety, the needs, the flow of students in and out of the building and classes. And so we all have also set meetings and if you haven't received information yet from the principals, we are looking to meet next week with staff. Some of us have leadership teams. We're looking to meet with them also. And then meeting prior to the task force next week, seeing what comes out of the task force from next Thursday and able to take in the feedback that we're getting from the staff on our initial blush for the information that we have on the people that are coming back and our needs to keep students in small pods and then making adjustments from that point in time. So again, everybody, and if you haven't received information, you will later on tonight or tomorrow of individual meetings happening. There's probably at least 2 meetings happening next week for small group and then full staff.
Thank you. So each building has set a meeting with whoever wants to participate in the planning process starting next week to start working through preliminary plans. Okay. So I just want to say to the community and to our teachers in particular, we are trying to be thoughtful about planning without planning too much, without having your say-so and your input into that process. So that's a delicate balance between we're not too well defining our space mission, but also leaving room to go to Mars instead of the moon. So I'm going to stop with that metaphor now because I'm tired of it. So I hope that assuages some of your concerns there as far as that goes. Other questions from anybody for the faculty, staff, association group? Shannon.
It's not so much a question. I just, I agree with what Jolene was saying in terms of anxiety levels and kind of the unknown feeling that's out there. It's not just in the teacher community, it's in the parent community very strongly right now. And we want an equitable experience for our children as well as we want our teachers to have an equitable teaching experience. So the sooner we can tie some of this stuff down, certainly the better it will be for the community as well.
Totally agreed. Okay, moving along. Georgia Delaney, anything from the student side that we've not covered that you have for additional input? It's okay if not.
I think just everybody, not a lot of students have been watching the meetings, but I've gotten like hundreds of texts asking, oh, what's happening with school? And I've tried to give the best breakdown I can of the original plan and say nothing's concrete yet, but everyone I've talked to has been really happy with what we have so far. Everyone wants to get back to school. It's just a matter of if they can or not. That's why, and most kids I talk to are like, I really just hope we can have people wearing masks at school because again, it's not about keeping yourself safe, but it's about keeping other people safe. And if we all agree to keep everybody else safe, then we're keeping ourselves safe. And so a lot of the upperclassmen, especially in high school, really understand that, especially coming from Souhegan. It's really like an ideology of ours to like keep each other safe and be good to each other. That's a hope from a lot of students, is that we will be able to have the best time we can if we just all do the most we can for a little while. So that's all I have. I don't know, Delaney, do you have anything else?
Only things that are very similar to you, so I won't say anything.
Thank you both. Bethany.
Thanks. I just wanted to go back real quick to some of the feedback from the faculty and staff group and just really echo that. So many of the questions that you're asking are the questions that we're really looking forward to feedback and collaboration on. So while we have skeletons in place, we really need staff to flesh out the day-to-day pieces and that collaborative effort. I know all the principals have identified several different areas that we're hoping that faculty are willing to say, hey, I'm really passionate about this aspect and I wanna help figure this piece out, so that it won't be overwhelming for anyone, but many hands make light work. And so we're really looking forward to sharing out some of those ideas and looking for feedback on them in the coming days and weeks.
All right. Question for this task force. Our plan was originally for you folks to be meeting between this week and next week with your subcommittee to further refine the plan and improve upon it. Some of you have already done that. Is that the best use of this next week? So I'm thinking of, we're 2 weeks from being where we need to be to then move to the implementation phase, whatever that looks like in early August. And how do we best use these next 2 weeks to go from where we are now to a plan that we're ready to say, we're all ready to sign off and move forward with? So how do we get from here to there in 2 weeks? Anybody? Shannon.
So I was following your timeline with our subgroup. We haven't met and we have 2 meetings scheduled. So clear direction on what you're looking for in terms of feedback from parents at this point would be helpful. There was a lot of confusion when a survey didn't go out. So I'm glad that you addressed that at the start of the meeting.
Okay. Yeah. My hope would be that, like today, what I received from the medical and scientific community was their recommended edits really to the plan, right? Additions, changes, things that they agree or disagree with. And so I would look for the same from the parent group. What is the general consensus of the parent group? There's not going to be agreement by any stretch, but and I'll lean on you, Shannon, to sort of distill that and make a recommendation on behalf of that group. We're at the fatal flaw stage of planning, right? Are there major things missing? Is there something that's way off that will prevent us from starting on August 31st and having meeting our objective of every kid making a year's progress? So that's what I would look for from that group, is really that level of feedback at and what other things we haven't considered yet. Other feedback about the next 2 weeks. Reed, and then Dr. LaBranch.
Thank you, Adam. I'm going to start out by apologizing to Shannon because I haven't been coming to these Zoom meetings that often. I've had a little medical issue and Dr. Vore there. It was only vertigos, but I couldn't concentrate and see one picture. So it was, I had some issues in the last couple of weeks, but I do, I've listened to everything you've said, and I have some questions concerning the town's perspective and whether you have spoken with DPW or the police, because I know they provide crossing guards. DPW does plowing and things in the wintertime, and how, if you have flexible schedules, how's that going to interact with the timing of DPW's work that they have to do? I was thinking about your bus services, how that it's going to be affected with bus services, and whether they're actually going to have drivers for buses, or that will be available to transport children back and forth from home. That's my question.
Got it. Yeah. Quite honestly, I've not gotten to that phase or that level of detail in terms of DPW scheduling for plowing and all of that. That's not come up, but a very good question about busing. Earlier today, most of my team met with the bus company to start working through those logistics specifically, because we know that's a critical part of the process. So if you could, Selectman Panisetti, keep those things noted so that we can follow back to those things and make sure they get addressed. Dr. LaBranch.
Keep them noted.
Thank you, sir. Dr. LaBranch.
Yes, Adam, having listened to the various subcommittee reports today, I think Jim Manning and his folks have given you and the committee a very nice tight package from which to work from with respect to looking at the initial recommendations. Similarly, I think that George is keeping a pulse on the student body. And when Shannon can come back with more information as well as the survey that you're going to be sending out with parents, I think that's a critical element that needs to be added to the overall structure of the plan. But what I heard today mostly was it's time to get into the weeds, and it's time to get into the weeds with respect to the leadership team, the principals, and the instructional staff, and to find out from their perspective how they see any of this working. So I think the best use of time this coming week is going to be the work that these folks are able to at least begin as you prepare to come up with the final plan or arrive at a final determination to bring forward to the school boards and the SAU. And that's my observation from high above today.
I appreciate that. Hearing that, all right, before I answer, Mike Berry.
Yeah, thanks, Adam. A point I wanted to make is as we get into next week to follow up on Dr. LaBranche's comments is when there's options for meetings, I know it's the summer, but if people want to be involved, you know, we need to make sure that the faculty and staff, if they want to be involved, that they find time to attend, because our window of opportunity to work in, to get something out there is small. And so I think it's critical that, you know, people become involved during this next week and read their emails and communications. I know it's summer and it's tough to ask people to work, but I think that's going to help us get to a consensus, not an agreement, but a consensus, and people, you know, believe in the process. The other piece is thinking back to the surveys that were initially answered in 39, way back at the beginning of the task force, was the parents, they need to fill out the surveys as accurately as possible and get as many people to fill out those surveys. So maybe that's something as a district admin team that we can work on getting it out on different platforms so we can get better numbers, because if we don't get the numbers on the survey, you know, the survey sometimes becomes like, oh, only this percentage filled it out. So it's really not what people think, but we don't have time to do another survey in 2 weeks, you know, from parents, or glean more information from the faculty, because the window is kind of now. I just wanted to make that note. My opinion's only, not a reflection of the district.
So looking at our principals, are all of your meetings with your faculty to start this process prior to next Thursday? Yes, Anna, Bethany.
Are
I think Bethany froze.
Yep.
The answer is yes, I think, for everybody. I think our timeline lines up by next Thursday.
Can I jump in here, Adam? Yeah. So I have been in discussions with the teachers, but in terms of our full faculty meeting, that is not until Thursday morning.
Okay. So I'm wondering if, so part of my confidence level right now is based on what the work that our administrative team has done in the past week with the draft plan that is then going to be rolled out to faculties next week leading up to next Thursday. I'm wondering if it'd be helpful next Thursday to have more of an in the weeds presentation from each school about how you plan on your initial starting point for making this all work. Because I think that this general task force will be really helpful in providing feedback, and it will also start to give us the opportunity to get in the weeds, as Dr. LaBranche just mentioned. So principals, it's hard for you to say no to me right now on the spot, but can I put you on the spot next week to sort of run us through what your level of comfort level with where you're at in terms of the planning process for your school? Yeah.
Absolutely. Yep.
I feel really good about that just because I've seen where they're at so far, and I've had to, frankly, I sincerely had to say, slow down a bit. We need to make sure that you don't go too far without faculty input and have to double back. So they're really doing good work, and that's part of where my confidence level comes from. And it just dawns on me from Dr. LaBranche's comment that all of you might gain confidence as well, having the opportunity to hear it. So I think that's a good plan for next week, for next week's discussion. In addition to hearing from the parent and community group, that Shannon is desperate to provide to us next week. Shannon, do you have another comment?
I do. I just wanted to piggyback on Mr. Barry's comment about parents completing the survey. I had multiple parents and subgroup members reach out this week looking for that survey, so they're eager to coordinate their plans with the district. We've had, you know, every subgroup meeting that I've held, we've had up to 45 people on the Zoom giving up time over their summer as well. So I think we're all in it together, which is a really remarkable thing that our district is doing. It's not easy. It's really hard and the conversations are difficult. But I think, you know, the parents and community really want to have a say in this as well, and appreciate the opportunity. And also have a lot of questions, right? The draft plan creates a really nice framework. It gives us choice, which there was, you know, we're all in the same storm that is COVID-19, but our boats look different. Our health concerns, our childcare needs, the educational outcomes that, you know, and how our students, you know, learn and what they need, social, emotional needs. And so the plan hits at the core of that, right? It gives people choice for the boat that they're in, which is awesome. But then all these other questions now need to be filled in. What does online learning look like? Is it going to be like it was in the spring, or is the platform going to change? You know, if my kid has to come to school in a mask, can they handle that? How am I going to help them get ready? The sooner we can answer all of those questions for the parents as well as the teachers, right, the better. So I look forward to asking those questions of the group and bringing their feedback. Those are my thoughts, which is what I thought we were tasked with bringing today, and we'll bring theirs back next week.
Great. All right, with that said, any final comments from anybody before we move along? Again, to recap, between this week and next week, our principals will be meeting with their faculty to gather input and to roll out their initial implementation plans. By next Thursday, they'll each present those here in this forum for this task force review, and for us to then move into more of the planning phase as we move towards July 30. I will revise the draft document and with, how do I put this? I guess my reaction to the medical and science community's recommendations today, and my revised recommendations based on their guidance, so that I'll be able to present that next week as well. And we'll go from there with additional feedback. A survey for the community will be put out no later than tomorrow. One final note I meant to mention earlier is I'm in the process of recruiting one of our school social workers to be a part of this task force, because as we move into the social emotional learning arena, we need to, I think, have representation up at this level to advise us. So I'm working on that. I hope to have someone identified by next week for that purpose. Anything else before I go to the Q&A side? All right, so we will shift to the Q&A. I'll keep the recording going, and I'll move through some of these. It looks like some were being answered along the way, which I appreciate. And anyone who needs to drop off certainly can. And I'll answer these probably for about the next 10 to 15 minutes, and then might have to pause. So let's see. The folks who created Pickup Patrol said they're working on an adjunct to that app. Yeah, so we are aware of that, and we are looking at potential third-party apps to help us with a lot of this planning process as we move forward. I respect the desire to accommodate folks, that everyone is comfortable, knowing that in reality this is not possible. I worry about having too many moving parts with having 10 sessions and student staff moving in and out, et cetera. It feels like this creates multiple areas for breakdown and confusion. And someone else agrees. Yeah, don't disagree. Some of our reaction to all of this might be, we don't need to do staggered start at one of our schools, at others of our schools, or what have you. Or maybe we need to think about this differently. So I don't disagree. Remember, this is just a draft, but the competing interests of social distancing and having a rigorous education are in conflict in a lot of ways, as are, if we believe that we're not going to compel someone to come to school when they don't want to, then unfortunately, it's not going to be a simple solution. So I'm all for simple whenever possible. I'm not sure what this comment is. Ms. Eastland, I've yet to be in a classroom where kids aren't talking even when during quiet work time. We'll work on your behavior management skills in classrooms. Just a note there. It was so that for a bit on the front. Okay, so Lisa, if we can catch up later, that'd be great. How would a fire drill work? So the same as it does now, there's going to be a need to empty the building. Everyone's going to have to wear a mask during that, obviously, if that's the recommendation and that's the status we're in at the time. So I think the same. Oh, we have someone from the attendee side who had their hand raised. And Lynn, you can reach out to me with your specific question. We've not been accepted questions besides through this Q&A so far, but feel free to send it to us or email it or what have you. Would it be possible to use portables for the nurses' offices? We're going to have to expand our nursing stations. We know that that's one of the recommendations and guidance from our medical subcommittee. So we know that's going to be something we do. Having them out in a separate facility. We can't have that in place by August 31st, just logistically, but I'm not even sure that that would be a recommendation. But Deanna, if you folks look into that and feel that that's the best way to go, you can certainly make that recommendation and we'll look into it. I hope we will look at shields for K2 teachers as well. We work in close proximity with all children in our classrooms. Thank you, Becky. Would it be, okay, same question as before. What is the plan if a child is positive in my child's classroom? Is the class dismissed? Is the school closed? Something in between. And it was really helpful for Dr. Allen to note that the practical realities we're not necessarily going to even know that it was a particular student. We're going to know someone's absent, but we're not probably going to know the reason why unless they tell us, which they're not compelled to do. So we're probably not going to be able to say that. But again, I still am interested in the possibility of publishing attendance data for our schools for parents to be informed about that. Thank you for these new recommendations. What is the total number of teaching staff that we have? So we've got about, I believe it's about 400 teachers throughout our SAU. That number could be off a little bit, but it's roughly that number. What about snack time? Middle schoolers need snack, as do all other grades. Might add teachers do as well. Could there be a time when kids take out their snacks, sanitize their hands, or move masks once everyone is seated for a 10-minute snack break midday each day? So I think that goes back to a great question about mask breaks. I would need more clarity from you folks, Deanna, Dr. Allen, Jim, about if a mask break has to be outside or if it's done in that classroom. Are we negating all of the good work we've done wearing masks for the last 50 minutes of that hour? So I would like you folks to weigh in on that if you could next time, not necessarily today. I don't want to put you on the spot. Everyone keeps mentioning taking the kids outside. That's fine for the first few months of school or nice weather days. What about when it's raining or freezing cold? I think we just need to give our kids a story about having to march uphill both ways to school in a foot of snow, right? We're giving that to future generations. So great point, and clearly that's going to be an issue. So the use of the outside continues for most of our school days. It's hardly any day. There are some during the winter where it's too cold, but in general, we try to get kids outside for recess no matter what. And so my sense is that's going to be extended and taken to the max whenever possible. But clearly we're not going to put kids at risk outside. My employer set up an anonymous reporting functionality where employees could report that they've been sick. If the community and staff buy into the premise that you're highlighting here, we may be able to get some value in something along those lines. That's a fair point for consideration, indeed. For kindergarten, if they're required to be in person in schools, what happens if the status level goes high enough that the school buildings close? Well, we have add-on instructions. So there's been a lot of questions about my comments last week about remote kindergarten and its value. We'll talk more about that perhaps next week, Anna and Kim. But I go back to, I really struggle with the concept that we have students in a remote learning environment that have never been in our schools before, that we've never met before, and some of which have never been to any school before. and the value of that. And it could be that we strongly encourage parents to wait a year and send their kids a year later for kindergarten. It might be that we still offer a remote, even despite our recommendation, we still offer something remote for kindergarten. I think we're all just saying, gee, that seems really ineffective. Let's be candid. That's not going to be a great learning experience for kids. Yes, on the simulation, test, learn, iterate. So that's good feedback and a great point. The data we're getting from parents and staff is going to help inform that for sure. Is a staggered start just for the purpose of busing? No, it's not. It's because it does limit the number of students in a school at one time if we have 2 different schedules. But again, it may not be necessary or even likely. Plus, if we're segmenting students at the elementary level where they're not moving a whole lot, it might negate the need for that in the first place. But more on that next week and more. I've not even heard the update on the busing meeting from earlier today, so I'm not even sure it's possible. As soon as more details about what a day is going to look like, then parents and staff will be able to answer the surveys more accurately. I agree. That's a downside, and that's kind of why I drug my feet on releasing the survey last week. But good point. In terms of enrollment numbers, is there a date by which parents need to let us know they're going to homeschool their children as opposed to choosing remote instruction through the district? The answer is no. A parent has the right to homeschool their child at the drop of a hat at any moment and at any time for any purpose and for any reason or for no reason at all. And nothing we do will ever stand in the way of that. And state law is very crystal clear about that. I think Reed wrote that law, the homeschooling law, right? So, Representative Panicetti? I'm just trying to put him on the spot.
The answer to that is no.
Will the concept of more built-in flex days be considered in revising the plan? Yes. Wait till you see what your building level leadership has done with their schedules, for sure. I think it'd be helpful to have a set default for what happens when students if something undefined comes up. For example, if a student gets sick or an unanswered question is taking time to solve, the student automatically gets put in the remote learning class temporarily. This may have been implied. Absolutely, that's a great point. So the parent selects in-person instruction for a segment of the school year, but then that child tests positive for COVID-19 or is just simply unavailable for illness or what have you, yes, they would switch to the remote modality. Okay, in response to my comment about people not needing to tell the school if they are COVID positive, what happens if a student or staff member tells the SAU that they are positive? Well, we have an obligation to keep confidentiality of staff member medical information confidential. We're not subject to HIPAA as a school district, but we still have similar confidentiality requirements. So that's not something that we would publish, but we would be compelled to keep that person from attending in person in classrooms, clearly. Let's see. Is a staggered start a done deal? Nope, nothing in here is a done deal. In my mind, besides August 31st, we're starting school. We're pushing launch on our school space shuttle. I said I would be done about that, and it slipped in one more time, no more. And thank you for those who are texting me pictures of rocket ships and space shuttles and all of that. That's not lost on me. How many of you are heckling me via text? Comment regarding the plastic shields and desks and not using masks when sitting there. This does not address the issues with HVAC or airborne virus. Agreed. So more on HVAC systems coming August 10th with our board meeting. That's going to be a big topic. There is virtually nothing we can do to our HVAC systems in terms of the systems themselves by August 31st. In fact, if we had all the money in the world and it'd even be a push to have something for next August 31st, because these are long lead items and not simple replacements. So, but we are going to have to be aggressive with our HVAC systems because they are a critical flaw of our buildings. Notification tracking is mentioned on page 9 and 10 of the New Hampshire State Plan. DHHS assists districts. Yes, indeed. They assist with tracking for sure, and they have an obligation to do that. How does staggered start actually limit the number of kids in the school? If half of the students come at one time and half an hour and a half or an hour later, then for that hour, hour and a half, there are half the number of students in the building, and then the reverse at the end of the day. Again, it's not the whole day. It's not an A/B schedule. We're not recommending an A/B schedule of any kind. Can you consider UV in the ductwork? Absolutely. We're looking at several UV things. If we ever did an HVAC upgrade, I was already a big fan of UV light, UV light systems and air systems, because they're known to be very helpful with these sort of things. So, that appears to be all the questions. I thank everybody for their participation. This video will be posted online shortly, and we'll see you all next week. Thanks, everybody.